Hi, myself Arman Alam. I am from Jalalabad State University. Today I am going to discuss about diabetes mellitus. What is diabetes mellitus? It is a group of metabolic disease characterized by increased levels of glucose in the blood, which is called hyperglycemia. Related to an endocrine disorder causes abnormal insulin, both abnormal production and impaired utilization. Etiology and pathophysiology of diabetes mellitus. It is produced by the beta cells in the islets of Langerhans of the pancreas. Facilitates normal glucose range of 70 to 120 mg per deciliter. Types of diabetes. There are three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes, known as juvenile onset or insulin dependent diabetes, most often occurs in people under 30 years of age. Causes of type 1 diabetes mellitus. It is genetic predisposition related to human leukocyte antigens and exposure to a virus. Onset of type 1 diabetes mellitus. Manifestations develop when the pancreas can no longer produce insulin. Rapid onset of symptoms. There will be weight loss, polydipsia, polyuria, polyphagia. Type 2 diabetes mellitus. This accounts for 90% of patients with diabetes. Usually occurs in people over 40 years of age. 80 to 90% of patients are overweight. Etiology and pathophysiology of type 2 diabetes mellitus. Pancreas continues to produce some endogenous insulin. Insulin produced is either insufficient or poorly utilized by the tissues. Like it is insulin resistant, body tissues does not respond to insulin, it results in hyperglycemia. Onset of type 2 diabetes mellitus is gradually onset. Person may go many years with undetected hyperglycemia. 75% of type 2 diabetes is detected incidentally. Gestational diabetes. It is mainly develops during pregnancy, detected at 24 to 28 weeks of gestation. It increases the risk of cesarean delivery, perinatal death, and neonatal complications. Secondary diabetes. It results from another medical condition or due to the treatment of a medical condition that causes abnormal blood glucose levels, which is from Cushing syndrome, hyperthyroidism, and parenteral nutrition. The clinical manifestations are polyuria, polydipsia, polyphagia, weight loss, ketoacidosis, fatigue and weakness, sudden vision changes, tingling and numbness in hands or feet. Let's come to the diagnosis. Diabetes is diagnosed and managed by checking your glucose level in blood test. There are three types of tests that can measure your blood glucose level: fasting glucose level, random glucose level, and postprandial glucose level. Fasting plasma glucose level will be more than 126 mg per deciliter. In random plasma glucose level will be more than 200 mg per deciliter. In postprandial level will be 180 mg per deciliter. Treatment: nutritional therapy and drug therapy. Let's discuss about nutritional therapy. Assist people in making changes in nutrition and exercise habits that will lead to improved metabolic control. control of total caloric intake to attain or maintain a reasonable body weight, control of blood glucose levels, and normalization of lipids and blood pressure to prevent heart disease. Nutritional therapy for type 1 diabetes mellitus. Meal plan based on the individual's usual food intake and is balanced with insulin and exercise patterns. Type 2 diabetes mellitus, emphasis placed on achieving glucose, lipid, and blood pressure goals. Calorie reduction. Calculate daily calorie requirement. Carbohydrates 50 to 60% of caloric intake. Majority of calories should be come from grains. Drug therapy. Insulin. It's required for type 1 diabetes. Prescribed for the patient with type 2 diabetes who cannot control blood glucose by other means. Types of insulin. Human insulin. It is most widely used type of insulin. It is cost effective and it's decreased likelihood of allergic reaction. How to take insulin? Cannot be taken orally. It should be taken subcutaneous injection for self-administration and IV administration. Drug therapy. Oral agents. The oral agents are used only in type 2 diabetes mellitus. They increases the secretion of insulin by the pancreatic beta cells and improve binding between insulin and insulin receptors, or increase the number of insulin receptors. Used along with nutrition and exercise. In time, they may no longer be effective in controlling the patient's diabetes because of decline of beta cells. In such cases, the patient is treated with insulin. Thank you.